Assalamu alaikum. This video explains root cause analysis. It focuses on some key questions and their answers. It also provides examples of root cause analysis with different tools. The questions that we would like to address are: firstly, what is the meaning of root cause analysis? What is the benefit? What is the classification of factors which will lead to incidents in patient care, either in hospital or in clinics? The second question is, how does root cause analysis factor into the platform of clinical governance? Thirdly, what are the different tools with which we perform root cause analysis? And finally, how does root cause analysis bring about improvement in the system? So, addressing the first question about the meaning of root cause analysis, root cause analysis is a method or a methodology used to investigate an incident to identify health system failures. These may not be immediately apparent at the initial review. The effort in root cause analysis is focused on systems rather than individuals. Generally, in complex hospital settings, systems need to be reviewed constantly and improved to avoid patient care problems. The factors which contribute to incidents can be classified as follows. These are 9 broad categories of assessment. These include patient assessment, patient factors, staff factors, equipment, environment, information, communication, policies and procedures, and coordination. These 9 categories have been listed below in order of frequency from the highest numbers to the lowest. If we look at the acronym of these 9 factors, it is PPSEEICCP. If you memorize this acronym, you may find it very easy to list the factors which cause incidents requiring RCA. What does patient assessment mean? This category covers initial assessment and ongoing monitoring of the patient to evaluate patient risk. This means history, examination, investigation, and then ongoing care. What is patient factors? These are most importantly presence of comorbidities, which covers situations where the patient's clinical condition impacts the risk of adverse outcomes. So a patient with diabetes or hypertensive is likely to have more problems as compared to a patient who has none of these comorbidities. Pre-existing morbidities cause a higher risk. Other factors include non-compliance with the advice that is being provided to the patient and aggressive behavior of the patient herself or family members. Moving on, staff factors are also an important cause, and supervisors of different areas must continuously evaluate and assess that the staff have got basic training, that they have got the on-job training, have regular appraisals to ensure the team utilizes the knowledge and training in patient care and has a responsible and conscientious behavior and attitude. The knowledge of the staff, their skills and their attitudes are equally responsible for the delivery of reasonable care. The Human Resource Department will ensure the right person is hired for the right job. The work supervisor has the responsibility to ensure the person is suitably trained on the job to familiarize themselves with departmental protocols and way of working. On-the-job supervision and appraisal ensures that staff weakness is identified and corrected promptly. Continuing education is vital in ensuring staff is regularly updated and assessed. The Human Resource Department must periodically evaluate supervision, allocation of staff, scheduling, availability of staff, recruitment, and regular appraisals by supervisors. If there are any problems with the working of the staff, and if this is not recognized and not corrected, then problems will happen with patient care. Let's move on to equipment failure. Hospital equipment can fail due to many reasons. These include the design or operating faults, maintenance or calibration deficiencies, or suitability for the purpose for which that piece of equipment has been provided. Equipment should be available and compatible with all the other instruments being used for the patient. It should be appropriate for patient use. In case an instrument is not working correctly or has broken down, do we have biomedical backup for quick recovery from breakdown? Is enough quantity of equipment available so that if one breaks down, patient care is not affected? The environment also has a critical role to play in making sure that patient care incidents are minimized. This category includes factors arising from any aspect of the environment in which the hospital service is provided, including design and security. An example is if the distance from the labor room to the neonatal intensive care unit is too long and too far, then this is an unfavorable design. If the same corridor from the labor room to the neonatal intensive unit is exposed to the environment and to the outside air, again, this is poor design. If the passage connecting the labor room to the operation theatre is very narrow, the patient care providers will have difficulty negotiating the stretcher along that corridor, taking it longer for shifting the patients in an emergency. The environment also involves contracted services which may be outside the hospital premises or inside the hospital premises. Information should be complete, easy to understand, available and accessible. This is an important factor which can contribute to failure of patient care. This category includes issues arising from ineffective transmission of information to staff across disciplines, departments, units, hospitals, and between staff and patient or their families, caregivers, or advocates. Another factor is communication. This is between staff and patients and includes the following problems. Staff needs to communicate with the patient, but if they are too busy, this will lead to breakdown of communication and complaints. Staff needs to be educated about proper communication and they should know what to say to the patient. If they cannot speak the patient's language, they must have access to people who can do translation. We then move on to coordination of care. This category deals with factors associated with coordinating patient care arrangements, whether immediate, for example, transportation between sites, or longer term, for example, a plan in which the patient has to receive certain services after she leaves the hospital and goes into her home, such as medication or physiotherapy. Moving on to the last factor, which is a very important factor and is termed as procedures or guidelines. The department may not have a policy or a guideline about the process to be followed when a patient needs care. The policy may be present but is not freely available to staff. Or the policy is present but staff has not been educated about it. All the medical staff should be knowledgeable about these protocols. To summarize, this category includes any situation in which policies or procedures are unavailable, are not followed, or are not understood. The next question that we want to ask ourselves is, how does RCA factor into the platform of clinical governance? Root cause analysis, or RCA, is a component of risk factor assessment. Root cause analysis focuses on problems within the institution, while risk factor assessment has a broader playing field to allow the institution to survive and to thrive. Risk factor assessment is one of the pillars of clinical governance, and it acts mostly at institutional level. For example, it deals with laws, regulations, standards, corporate relationships, breach of confidentiality, human resource, and medication management. The next question we have to address ourselves is, what are the tools for conducting a root cause analysis or an RCA? There are many tools for performing RCA, but the common ones used in healthcare include the following three. One is a tabular method, in which we make a table and write down the factors in one column on the left hand side, and then start writing down the weaknesses and the remediation. Next, we have the fish diagram method, and then we have the 5 why method. The steps that have to be followed in RCA includes, first of all, to define the event or the complaint. Number 2, to find the cause. Number 3, to find the root cause. So remember, there may be many causes, but you have to find what is the root cause. Find the solutions, take action, and then subsequently you must verify that the solution that has been intervened or put into the practice is effective. Let us take an example of a problem and see how we can solve it by these 3 methods suggested above. A 32-year-old pregnant patient comes to the labor room. This is the case scenario on which we will do the root cause analysis. So this 32-year-old pregnant patient is 31 weeks pregnant, and she comes to the labor room complaining of very high grade fever with burning on passing urine. The receiving nurse informs the senior doctor in the labor room. The doctor assigns the case to the house job doctor to quickly admit the patient to the ward, take a history, send investigations, and start fluids intravenously as well as antibiotics. She asks the doctor to do a CTG and to stay with the patient until the first set of investigations come back. 2 hours later, the patient's relatives call the nurse in the ward. The relatives are very anxious because the patient is in severe pain. When the nurse goes to check, she realizes the baby's head is crowning at the vulva and the baby is born. The family complains to the administration, who asks the head of the department to investigate this case. The complaint is, why did the baby deliver on the ward bed without any assistance? We can solve this case by 3 methods. In the first method, we can make a table. On the left-hand side, in the first column, we can put down the different factors which include patient assessment, patient factors, staff factors, equipment, environment, information, communication, policies and procedures, and coordination. And then we can start putting in the next column on the right hand side the different weaknesses that were present for each of these factors. On the right hand side, we can see how we can remediate these factors. So for example, in the first factor of patient assessment, we write down a pervaginal examination was not done at the time of admission. And the remediation is, all pregnant patients who are being admitted from the labor room should have a pervaginal examination. Similarly, we can go into each and every one of the factors and identify the weakness and remediation and come to the conclusion that there is no policy for the assessment to be done on a patient who is transferred to the labor room or admitted to the labor room or transferred from the labor room to the ward. Next, we will use the method called the fishbone method to solve the same problem. Mr. Ishikawa worked in the industrial sector, and he made this method to systematically review every factor in a work environment which can be responsible for the problem. The head of the fish contains the problem, and the bones coming out of the spines are the categories which need to be discussed. In this method, we will have similar categories and identify the weakness of each area. In healthcare, we can use the same categories as in the tabular method. We can systematically brainstorm each category to identify problems and then to identify the root cause. We then move on to the 5 why method. Now, this is a very interesting way to try and understand the root cause of the problem. It has been seen that usually the minimum number of whys which is required is 5, and that is why it is known as the 5 why method. Sometimes you can even formulate the question with a what or a why. So for example, in this scenario, if we ask the question, why did the baby deliver on the bed without any assistance? The answer is because the patient was in labor and staff did not recognize the labor. The question number 2 is, why did we not know the patient was in labor? Well, the answer is that we did not completely assess and evaluate the patient. The third question is, why did we not examine the patient completely to include a vaginal examination when she was being shifted from the labor ward to the ward? Well, the answer is because we focused on the fever and the pain and did not consider labor as a cause for the pain. The fourth question is, how could we have avoided this problem? Obviously, the answer is, if we had examined the patient vaginally, we would have avoided this problem and we would have known that this patient is in early labor or in established labor. The last and the fifth question is, why did we not examine her vaginally when we did her assessment, patient assessment? Why did we not examine her vaginally? And the answer is, because we don't have a policy about how patients are to be assessed if they come to the labor room. Therefore, in the above case, within 5 questions, we concluded that to remediate the problem which arose, we must have a policy and procedure about how a patient is to be assessed if she comes to the labor room. Not only that, but we have also evaluated that patients can deliver in the ward even without any precipitating factors. And so there must be some arrangements on the ward to safely deliver patients in case they deliver suddenly on the ward. So in the policy, we need to include everything. What assessment should be performed, who should perform the assessment, what will be the role of the nurses, what will be the roles of the doctors. Similarly, we need to define what should be included in the policy on how to accommodate a patient who delivers in the ward. So we can summarize this talk on RCA by saying that we have gone through the 4 questions about the meaning of RCA, about how RCA is associated or connected to clinical governance, and what are the tools that we use for doing RCA, and how does RCA bring about improvement in the system. You can go to my channel, Acorn Learning, if you wish to hear other videos on these and similar topics. And apart from that, the